Over the last few weeks, Fox 17 has reported on the Trump administration's attempts to cut federal funding.
The president's team has repeatedly said it's part of an effort to better utilize taxpayer dollars and streamline government operations. One of the agencies impacted is the National Institute of Health. It is our country's health research agency. In 2023, it distributed more than $35 billion in research grants. Of this, $26 billion went to direct costs for research, while $9 billion went towards indirect costs, things like equipment, operations, and personnel. Earlier this month, a new policy was announced limiting funding for indirect costs to an across-the-board 15% rate. Now that policy has been paused by a judge after 22 states, including Michigan, sued.
Our Olivia Yatuma joins us live in studio after speaking with the Michigan State University official about the impact this rate change could have if all of this goes through. Olivia.
Yeah, Josh, Samantha, MSU's Grand Rapids-based research center houses 33 research teams. Areas of emphasis include Alzheimer's disease, Parkinson's disease, and women's health. An associate dean tells me losing NIH funding would stop their work.
If we have this kind of cut to the work that we do, we're just not going to be able to do it anymore.
Universities are the incubator for innovation. At least that's what Jack Lipton, Associate Dean for Research Analytics at MSU's College of Human Medicine, says.
When people ask me what I do, I always say I work for you, because that's what scientists do.
But what scientists here do could be done if proposed cuts to NIH funding go through. The college's dean, Dr. Aaron Sosa, put out a statement last week, reading in part, NIH funding has been so stable for so many years that the finances of the operations of the Grand Rapids Research Building are based on the federal reimbursement formula. Without this reimbursement, our building operations in Grand Rapids are not financially sustainable. The labs would literally go dark.
These kinds of cuts will stop the research that gets done to help us to fund early detection and cures for Parkinson's disease or for Alzheimer's disease.
Dr. Lipton says MSU would likely lose about $27 million.
There's two pieces that fund research. There's the project-based research that we do, which includes the funding for Parkinson's disease or Alzheimer's disease. And then there's additional funds that we receive that are related to the cost of running the laboratories in which we work.
And Dr. Lipton says this could impact the community.
For every dollar that is generated by NIH grants, an additional $6 gets infused into the community. This affects people that work here in West Michigan. It affects their jobs, it affects their livelihood, it affects their family's livelihood.
For now, Dr. Lipton is hopeful that the funding will remain and preserve what he calls the envy of the world in health and human disease research.
It will start to cause a decay in the quality of education, in the quality of medical care, and in the quality of life that we all enjoy now.
In Grand Rapids, Olivia Yatuma, Fox 17 News.
Olivia, thank you. On a related note, the Trump administration is giving America's schools and universities 2 weeks to eliminate any DEI programs or risk losing federal funding. In a memo sent out Friday, the U.S. Education Department gave an ultimatum to stop using what it sees as racial preferences as a factor in admissions, financial aid, hiring, or other areas. Schools now have less than 14 days to comply or lose eligibility for federal money. This guidance has not been met positively. Civil rights groups and universities are pushing back, saying its vague language is meant to have a chilling effect, pressuring schools to get rid of anything touching on the topic of race.
I'm hoping that leveler heads will prevail, and the idea of cost cutting using a blowtorch will not result in the catastrophic decisions that are being made as a result of these executive orders.
In a campus letter, University of Michigan President Santa Ono said leaders are working to understand the implications.